Good morning, everyone, and welcome to NPU Live. I'm Keri Rodriguez.
And I'm Tim Langan.
It is a Monday morning as we enter week 9 of quarantine.
That's right.
Across the country, coming live to you from Boston. It is not May 8th.
It is May 11th. May 11th.
So we are very happy to be with you today on May 11th.
That's right.
A beautiful Monday morning here in Boston.
Right.
We survived the polar vortex. We were supposed to have like this crazy snowstorm here in Boston and frankly, all up and down the East Coast that was going to shut us down for 2 days.
Shut it down.
Unprecedented, in the
That's
middle of May.
It's going to be the day after tomorrow, part 2.
That's right. And it didn't happen. Actually, nope. we had snow for about 5 minutes, which was weird.
Which I slept through. I didn't even see it.
You didn't see it?
I didn't even see the snow.
Oh, I thought when you were out there for a few minutes.
No, I had my snow pants ready and everything. Nothing.
He was ready, and that was quite a sight. But we did not have our polar vortex.
Nope.
It was a little chilly for a couple of minutes, but yeah, we're hardy New Englanders here, and it was
nothing we haven't seen before, guys.
That's right. So having survived the polar vortex, I'm excited that I can say now we're in the middle of May. We're in the middle of the quarantine, and it's a beautiful sunny day here in Boston. Hope you enjoyed your Mother's Day. I had a lovely.
Did you enjoy your Mother's Day?
I did. I had an amazing Mother's Day. Oh, I don't think I have my pictures. I thought I had my pictures here, but I had some extraordinary artwork. I am now the proud owner of the largest worm that you could find in the yard.
Yes.
One of my gifts was a plant, which was kind of. Well, it was not really a plant. It was all of the tulips that could be picked out of the yard. Plus a clump of grass in a pot, and the biggest, fattest worm I've ever seen in my life.
That's right.
Maybe the biggest, fattest worm in the Commonwealth of Massachusetts. And boy, oh boy, it is now in the kitchen. And
what's it doing in there?
I don't know.
Cooking breakfast.
I'm trying not to check it out too much because I'm not a worm, but having 3 little boys and 5 little boys in my life altogether, there is a lot of worm and disgusting action. So being a boy mom, it is
That's right. It is what it is.
What it is. Funny though, we were talking about how many little boys are in our lives, and a new trend that we've noticed: little boys not flushing.
No.
Flushing.
What is up with that?
And that is we're more acutely aware of that.
That's right.
Because of the quarantine. Boys just don't flush. So we're actually putting it out there. We've put it out on Facebook. We're asking all of you. As a mom, I'm going to turn here.
Yeah, because we get the.
I gotta talk to you here.
Okay. I'll get out of the way.
How do we turn this around? I don't know if this is just all little boys. There's a lot of little boys here. There's a lot of flushing or not flushing happening. Is this just a little trend for little boy? I need mama advice. I know some of you come here for news, for information, but we need you just as much as you need us. So if you're a mama out there that has successfully taught little boys, maybe it's 1, maybe it's 7, please help me. I need your comments today in the National Parents Union chat. On Facebook, please give me your tips, your tricks, or at least tell me I'm not alone.
That's right.
Because, oh my God, there is no flushing happening.
That's right.
Back to our regular scheduled broadcast here.
That's right. And before we do anything, I'm just going to make sure we get this logo thing here set up because you've got the prettiest face in parent advocacy. And I want to make sure this thing's not blocking you here.
Oh, goodness. Yes.
There you go. So why don't we just move over a little bit this way?
That's okay.
Why don't we just move over a little bit this way?
And I'll
this way, Daniel, if there's anything we could do, that'd be great.
That would be great for us to get updated.
We could take it all down all the way, too. That's not a big deal, too. We can figure it out afterwards here.
That's right. I'll just scoot over.
Just scoot over
We're
here.
friends.
Maybe that'll help. There you go.
So what else is happening in the news today, Tim?
You know what? Lots of great things that the National Parents Union is going to be taking part in this week. And you know what? It's really important. Unfortunately, the cases in the U.S. for the coronavirus are rising. 1.36 million confirmed cases. Mm-hmm. And again, every weekend the numbers jump. And especially with people opening up, less social distancing. We are now up to 80,574 confirmed deaths in the U.S.
We're now even seeing it in the White House, too, which is a little bit scary.
That is a problem.
We're now hearing that the White House staff is being tested every single day, but
Every day.
goodness,
Must be nice to be tested every day.
you have access.
We should probably do that in workplaces. But the good thing
or
is
every community.
every community, go figure. So we are working, we're trying to create a sense of unity here. We're working
across the globe.
Across the globe, that's right. And this Friday, we're going to have a special day where we're partnering with Parents Forum, a wonderful group who is doing International Day of Families. May 15th is the International Day of Families.
And so we are going to be celebrating in conjunction with Parents Forum and reaching out to parent groups across the globe, which is going to be incredible. We'll be broadcasting live to every single continent. You will find us in English, in Spanish, in French, in Chinese,
That's right,
in Arabic, in Haitian Creole, Vietnamese, you name it, all of those.
That's right.
Different kinds of languages. Well, which you typically get from the National Parents Union, but this time we'll be welcoming in international communities.
That's right. It's gonna be a wonderful day. So we're gonna have 5 half-hour broadcasts brought by our wonderful friends Eve and Jamel Bakai, who will be holding a session about how to tell somebody something they'd rather not hear. I think that's a wonderful resource. Sometimes you have to do with kids. Sometimes you have to do with adults.
That's right. Very exciting.
That's great. And you're going to see those broadcasts at 9, 12, 2, 4, and 9 p.m. Eastern time on Friday.
As you normally do here in the National Parents Union, 9 o'clock in English and noon time in Spanish. We come to you 2 o'clock for families with special needs. That'll be preempted that
That's
day.
Right.
4 o'clock, we have our mix of programming. You're hearing from Bernita Bradley in Detroit, Michigan. You're hearing from Dads, the
That's
Dad
right.
Conversation.
Dad show every Thursday.
Comes on at 4. Lots of interesting programming, a wide variety at 4 o'clock. But then at 9 o'clock, always checking out with you to make sure you've ended the day well. Our social emotional checkout for you at 9 p.m. with Marisol Rarucha coming to us live from San Diego. For that checkout.
That's right. We're also going to be working with the XQ Institute. Now they focus on high school students and their success. And what they're doing is they'll be working with various partners for a one-time broadcast. You've probably heard about this. Several seniors, high school seniors, expected to graduate this year. They're not going to have that memory of walking down the aisle, flipping the tassel over, getting their diploma due to social distancing. So there's going to be a one-time broadcast on the major stations. This Saturday, May 16th, it's going to be a busy weekend, 8 p.m. Eastern time. And it is going to be, it is Graduate Together 2020. So it is a tribute to high school seniors, teachers, and also to their families as well.
Excited to be partnered with the XQ Institute, our friends at the LeBron James Foundation as well, right. Bringing that. And you, again, can catch it on your local TV station, right. But you can also catch it through our partnership with the National Parents Union.
That's right. So you're going to want to go on graduatetogether2020.com. That's graduatetogether2020.com. We'll be putting this a comments page as well. And that's where high school seniors can actually share brief commencement messages if they want to. They can also upload pictures to a national high school yearbook, a virtual yearbook as well. And if you want to support that, you want to do #GraduateTogether.
That's right. And students participating can win up to $5,000.
That's really great.
Which is really exciting.
That's great. And I'm excited about who's doing the commencement speech. Barack Obama.
That's right.
Love that guy.
Barack and Michelle.
Actually, this one's the one with just Barack.
Just Barack.
There's a bunch going on. I went through that. I got a little course on the multiple.
Oh, I thought they were doing it together.
This is the one with just Barack, but there is going to be one later on with both of them. Hey, I'll take half of them.
That's right.
I'll take half the Obamas.
Barack Obama, not too shabby as your commencement.
Anytime I can, I'm easy.
Oh, man.
So there's a lot going on at the National Parents Union. And another thing that happened over the weekend was our survey. Our
survey, that's right. We got the results of our National Family Survey. Pretty incredible that we were able to get this together and really be able to take the temperature of parents across the country. So we want to take you through some of those results. And really 2 findings that were incredibly important to that,
right.
for that release, which has been picked up in the national news. Tim, you want to take it away?
Oh, absolutely. I would love. No, actually, that's no problem. I was looking at the logo there again, but let me. Why don't you take it over there, Keri? I'm
Yeah,
sorry
why
about
don't I
that.
do that while you fix the logo?
I'm sorry about that.
No, no worries at all. So two
It's Monday.
major findings. Yeah, it's a Monday. We're figuring things out. You know, as parents across the country struggle with technology, so goes the National Parents Union. But what was clear, one of the biggest finding by a 2-to-1 margin, is that parents and families across the country have made it clear, until we have a solid plan for how we are going to make sure our schools are safe, that our children's health is protected, that we have disinfection plans, frankly, that we get closer to a vaccine, parents are not quite ready to send their children back to school. And we bring this up and thought it was important for us to really weigh in on this because there's been a lot of conversation about reopening. It seems to be dominating the day. But survey after survey comes out. Our elected leaders are clearly well ahead of the population on this, where they are ready to reopen. They're feeling the pressure of politics, the pressure of economics around reopening, and because, you know, frankly, it's an election year. It's 2020. There's a presidential election. There are a lot of critical Senate seats that are open, and so I think there's a lot of panic saying that at this moment we've got to reopen. And the conversation that parents and families are happening is that they're not quite ready to allow their children to go back into public buildings until we have a solid plan. And that includes wearing masks. How are we going to disinfect classrooms? How are we going to have social distancing in places like elementary schools? We've talked quite frequently about the fact, again, little boys are going to be little boys, little girls are going to be little girls. What does social distancing actually look like? When you're 7, 8, 9 years old and you're used to playing with your friends on the playground, and whether or not our schools are going to be prepared just from a health perspective on what that's going to look like. So by a 2/3 margin, 67% of parents saying schools should remain closed until they are certain there is no health risk, even if that means students fall farther behind. And some of our friends in the education policy space are going to say, oh my goodness, they're so focused on the falling behind that I feel like a lot of folks are really losing sight of again, what we've been trying to talk about, which is the humanity of this.
Right.
Everybody is falling behind. All our children are falling behind. And what does that mean? It means we're going to have to come up with some innovative solutions to catch them up. But first and foremost, if we do not protect the health and safety of our children, of families, of our elders, what do we really have? And, you know, I'm sorry to put it in black and white, but I would much rather have a little boy who is alive,
Yep.
and healthy, that maybe needs some help with reading than have a little boy who ends up on a ventilator or a grandma. Right now, and I'll share with you this morning, you know, there are members of my family who are saying goodbye to their grandmother, who was lost to COVID-19, a woman who has lived an extraordinary life, who is really the center of their family, who passed alone in a hospital. And, you know, they had to pull names out of a hat to decide which of her grandchildren would be able to attend her service at the end of a beautiful, long life. So really put your humanity in context here. And I hope that the information and the data we've been able to offer is going to be able to help inform that conversation. The other thing too, which was really stunning, is about how parents have really been given an opportunity to have a front row seat to what their kids are experiencing in education right now. And they've got a lot to say about whether or not it's time to go back to that and to shove us back into those boxes. We would contend that for so long, our children have been underserved in a status quo that just simply leaves Black and brown and low-income children behind. And, you know, that's been the focus of the National Parents Union, of our more than 200 affiliate organizations in all 50 states, DC and Puerto Rico. That's the work we do every single day, is fighting to disrupt that status quo. So we really wanted to ask families that question. Do you think we should try to rush back to that status quo in education? Are you anxious to just get your kids back to school, you know, as it was before? Or do you think this is a time to reimagine and innovate in education? And again, by a 2-to-1 margin, parents are telling us that the time has come to rethink education, for a whole host of reasons, from technology perspectives, from what kids are learning, all of these things. And we're going to explore this more in the coming weeks, but the message is very clear from families. Health and safety comes first.
Right.
And it is time to rethink how we do all of this in turning this unprecedented challenge into an unprecedented opportunity. So really excited that the voices of parents and families are being heard in this moment, and that we're able to really make sure that our voices are a part of the conversation around, what it looks like in the coming months.
That's great. Good job, Keri.
There we go.
You worked really hard on that survey. It came out great.
I think it's wonderful, and there's more to come because we're going to be doing this every single week, and I think it's really important. It's very easy for folks, and I've seen this so many times in the advocacy world, to kind of dismiss parents. Oh, you don't know what you're talking about. You're not experts. You don't have anything to offer. Well, that's just a story, based on your neighborhood, your community, your school, your kid. And parents are smart, and we know that we need to quantify our anecdotes with data. So now we're going to be having a data-based conversation. Yes. We're going to be saying, this is literally what families think because we went out there and asked them. That's right. And what's been disappointing is to see so many education policy experts, so many systems doing this work without consultation of families, without consultation of community. And that's what we're here to disrupt.
That's right. Well, now let's get some feedback, I think, for some parents.
That's right.
We've got some fiery parents on right now.
One of the most fiery parents that we have in our entire union, a dear friend of ours and an extraordinary leader. I never thought, I'd have such a deep connection with a lady from Northwest Arkansas.
Oh my God.
But parents, it's just so extraordinary when we're able to connect in the commonalities that lie between the struggle across the country in all different kinds of communities. Judith Yanez is joining us from her organization. She's the founder and executive director of Rooted NWA, Northwest Arkansas. She's our homie. She's one of our hosts of the Spanish broadcast of the National Parents Union Live at noontime. And look at her in her red. Girl, you are giving me life this morning. Oh, and you're on mute, so you got to take yourself off mute, girl.
There you go. Lady in red this morning.
How are you? How was your Mother's Day?
It was amazing, Keri. Like for the first year, and I think it's been around the National Parent Union that has allowed me to grow in my voice. But I was like, damn it, Judith, you don't love yourself, so it's the first year that I'm like, not taking this anymore, right? Like, you are badass, you're an amazing mother, and you deserve to love yourself.
You do deserve to love yourself because you are extraordinary and you do incredible work, and you're an incredible mama. So tell me about your day and how you enjoyed Mother's Day this year.
So let me tell you, we have our mother leader group. So we got a mariachi band to dedicate a song to them. So that was the first thing. And I think this is when you have love for yourself, you show the love and it blossoms, right? We also surprised that mother leader group with flowers. Mm-hmm. So the whole team went and delivered flowers to all these mothers. It was beautiful, surprised them. Then I went to go visit my mom. And it was like, I love her. Like, this is a warrior that crossed the desert undocumented to come into this country, and they're just powerhouses. So I just had to embrace that, that's where I come from. That's my lineage. And then I come home and my son's like, oh, you're here. So the day before he had sent me a shopping list. And so Mama Bear already, I was like, oh, he's making chocolate covered strawberries for me. They're my favorite, right? But he threw in a waffle mix in there, so I would not catch on. But we're moms, we know.
You were not.
Yeah, but I think it was just amazing. My daughter's not here, so he was just like, both of them together decided what to make me, and it was just great. That simple gesture of, geez, this is what my mom loves.
All these things are so beautiful because it's the essence of you, Judith, in the work that you do. It's service first, and serving your community and being an extraordinary leader and recognizing all the extraordinary women you see. It is, taking a moment to, honor your ancestors, honor your mom, for all that they've given that makes, your work and who you are as a mother possible, and then reflecting on the future.
Yep.
I hope in some of that there was some, taking care of Judith too, because you, again, a powerhouse. You were doing extraordinary work with the immigrant community in Northwestern Arkansas, a group of folks that are so often unseen. And frankly, you're in the thick of it, politically, socially, every avenue you can imagine. I cannot imagine being the leader of parent immigrants in Northwestern Arkansas, but you are in that fight and you are leading that. So did you take a couple of minutes to kind of just take care of you? How do you even do that as a mama?
So I put on the music, Latina. I was dancing, I was singing since early in the morning. My poor son, like Juan Gabriel came on and I was like, no, we're going to be jamming today. Those are my roots. And so here in Northwest Arkansas, it's hard to connect to your identity and your roots because it's pretty much our white population, overpowers us. But I had to do that. It was like, I am going back to my roots. And so I danced and sang. And at night I had a glass of wine. That was it. And
you and I are really kindred spirits because I tell my babies all the time, we dance in the kitchen. We're like a dancing, singing family. And they woke me up yesterday morning singing to me with a song that they had the lyrics printed out. It was amazing. But, that is one of like dancing and singing and just, being your full self. I love that. And I tell them all the time, I give them a hard time because they're always like, Mom, I don't want to dance. I said, listen, God gave me 3 little boys. So I will never be without a dance partner. And you will all learn to dance. And, everyone will love you because, who can resist a man who can dance well and loves to dance with his mother? Come on now. That's what we need in this life.
Yeah. So it was great. It was just great for once, but I can't wait to do this more often.
I love it. And a part of why I love this connection that we have too is just watching you grow in leadership and your voice and your strength and your background. That's kind of, what we always hoped for when we started this crazy National Parents Union, saying, we all need to be connected. We're all doing extraordinary work, these pockets of parent power all over the place. But when we come together and we realize we're not alone, we're so much stronger together. So can you talk to us? I want to get your, I say that all the time, but that was the idea in my head when we came up with this thing. So what has it been like? You were with us. We gave you a phone call and said, Judith, will you come from Arkansas and help us build the National Parents Union? Tell us what it was like to get that call and your evolution with us.
First of all, like I heard you speak before that, right? You were in panel discussions and conferences that I felt I did not belong in. Like it was just like bigwig people. And it's like, you don't get this. I need my people on the ground. And when I heard you speak, it was like this instant connection of like, she gets it. And so when we went, what I loved most of all when I got that call is that I had mamas that did not speak English. And there was no barrier. It's like you guys had translating services, you embraced them. And that was the first thing when I got that call. It's like, okay, our mom's gonna have a space. And it was like, yes, definitely, these are my people. But when we were there, that was magical. It was spiritual. It was a room full of people from the hood. We all grew up in the hood. We knew how to fight. And people get scared with that. Like people get scared with that and they question me, are you really from the hood? I'm like, I'm going to question, why are you thinking I'm not from the hood? What perception do you have in your head, right?
Well, I say don't let the Kate Spade fool you.
But it was out of this world to belong, right? Because most of the time you are left out of conversations, and National Parent Union was pulling you in to have a voice. Mm-hmm. And so it was beautiful. It's like I found my tribe.
Well, it was extraordinary, the effort. I mean, you talk about coming down, you came from Arkansas down to New Orleans, but I got to say, your group in particular made such an impression on us because you would not be deterred. And, mamas that may have been afraid to get on a train or be afraid to get on a plane, they were going to show up, and you rented vans and you said, we're going to drive 12 hours because, some of our undocumented mamas, not comfortable with, certain modes of transportation right now in this era of Donald Trump. But you made it happen. Again, it's that can-do spirit. And that's why, us here in Massachusetts, Bernita in Detroit, Michigan, Minnesota, California, Washington State, Tennessee, Florida, Texas, all over the place. We have put together a team of titans, of folks that do this work, that, find, that spiritual connection to fight as hard as we can to make sure that the voices of our communities are heard, and it just gets stronger every single day. But it was emotional seeing you guys roll up in a van saying, you know what, we're coming. If we got to drive 12 hours to get to the convening so that we can make sure if there is a seat for us at this table, we're going to find a way. But that was quite a journey for you guys to actually get down there.
And the way those moms have grown in voice too, it's beautiful.
Yeah.
Because they never had that opportunity to leave Arkansas. Or, they came from their country, they came to Arkansas, and that's all they knew.
And they also taught us how to say Arkansas too. But I mean, it was just extraordinary to be in community with them. And it's always our honor that people, collaborate, and we're able to co-create that together. And I hope we're staying true to that. There's a lot of folks, since the beginning of this pandemic, really seeking the National Parents Union, wanting to be a part of us. Now, girl, we're reaching over 1 million families every single week with these broadcasts. It's extraordinary. And it's because parents are really seeking this unity, this solidarity, this comfort in knowing that, we really are on the front lines trying to hold it together. And folks like you and I have known this for a long time. Even in pre-COVID times, in the best of times, a lot of our people were struggling. But now, being able to find other folks that are going through difficult times, we need this. It's spiritually important. And frankly, if we are going to have what we're envisioning as being an equity-infused educational recovery, economic recovery, we need to step up and be able to walk and chew gum. But you have been doing extraordinary things in your community. Talk about walk and chew gum. You're a leader for the National Parents Union, but on the front lines of just making sure that, folks in your community have food, have some resources, because again, working with the immigrant community, working with, families that are documented, undocumented, frankly, working with folks that are Black and brown and are underserved for a whole wide variety of reasons, because as we always say, racism did not take a break because a pandemic started happening. You've been on the front lines. Talk to us about what the work has looked like for you in Arkansas, and what you guys have had to step up to the plate and do to serve your community.
So the fascinating thing, I'm the first Latina elected official in Northwest Arkansas, but pretty much Arkansas. And so I don't have any mentors that are Latinos in the area. And so what's happening is you are fighting really hard not to assimilate yourself to a white culture. It's like you're having to stay in your own identity and being authentic for your people. And so the first thing for me is growing in leadership and the amount of time and money I spend for coaching. Because the work is limited by my own perspective. And so that's number one. And I am thankful for the people that really believe in me and this work, because at times it looked messy. It looked like I had no clue what I was doing. But in order to grow in your voice, you have to take chances. And sometimes that doesn't look pretty. You are centered spiritually, but the outside world does not mimic you, who you are. And so that's the first thing. The second thing is that our immigrant population here in Arkansas has been told what to do, and they just follow blindly. They know no better. And so now it's like disrupting those systems, which again looks messy. And when you don't have anyone else in this area doing the work that you're doing, it's like you're alone out there.
And you can, in your own head, start to feel like I'm crazy. Maybe
You,
people are right.
yep, you're crazy. They're white. They know what they're doing, and so that's the number two thing is like having people like the National Parent Union have your back and that you're not crazy. That, I mean, that just amplifies the work automatically, you know, because it's like, go. And the third, and this is the most important thing, is for the last 3 years, you know, the nonprofit Rooted was established. Thank you, Walton Family Foundation. But parents didn't know what an education was. They didn't know how to navigate an education system. And so I'm not one to believe that you create programs for parents without their voice. And so for the last 3 years, it was really navigating, walking side by side with parents to understand what was happening psychologically, what were the fears, what were the barriers. So we would create some programming and then all of a sudden have to pivot somewhere else because what we thought was what was happening wasn't. So finally, after 3 years, I see this, Keri, as like we planted a seed. It was underneath the ground. Storms came, you know, that seed was trying to grab roots. And finally, right now, after 3 years, we're at a point that it wants to blossom. You know, but it's tough work helping parents know that they have a voice because you are breaking intergenerational trauma. You are breaking their own fears, their barriers that limit their child's future. But then you have structures that are oppressive that are also limiting their child's future. And so you're navigating all that murkiness to try to figure out a solution. And then the solution's ever changing.
Yeah, it's like trying to hit a moving target, and these situations are so complex. And you know, those of us that work with immigrant populations and immigrant families, we know this. You know, when you're coming from, you know, I think about our families from Guatemala and El Salvador, and all of these folks that are coming in, or Venezuela. I started with you know the communities I was most familiar with, and it was stunning. Even you know, being second generation myself, I don't think I understood it, you know, from the perspective when you are fleeing oppressive governments and then having to have conversations with immigrant families around, well, no, it's okay and acceptable here to challenge the government or trust this government, or like having these conversations with her, which are so incredibly complex. It is, you know, watching that happen, but in the end, seeing the leadership grow and blossom and people come into their voice and their truth and finally starting to get some wins has been extraordinary. But now we are in the time of a pandemic. And I got to tell you, Judith, I worry, you know, because this has been an unprecedented challenge. It has highlighted for many people the deep inequities, the racism that exists in our society on all levels. I mean, you know, in healthcare, in our economics, in our education system. These have been things that we've been talking about forever, that we've kind of been pushing to the side, saying, you know what, you're crazy. We've solved for that. You know, this is not the 1960s. It's better than that. But this situation has really shown us how bad it truly is. You know, and right now in this moment, I'm just finding it's critically important. I mean, you are literally doing everything from getting gift cards and those Visa cards so people can actually have some money in their hands because they're not getting hit with the economic stimulus. They're not getting the food deliveries. People are afraid to go to food pantries. If they go to food pantries, they don't know what to do with the food because it's not culturally like we don't have culturally competent systems that understands like handing, you know, Latino families a bunch of instant oatmeal is like, you know, not helpful. What are you doing here? You know, all of this has really shown us that we've got a rapid response to serve our communities, but at the same time, how critical it is to advocate. What has it been like for you to kind of have to do both of those things? It feels like 24 hours a day, this work is happening. And how are you managing that?
I'm trying to find the balance still on that. I think we're on the same page with finding the balance with the work. The one thing, again, here we don't have those structures set up. We are culturally competent. So yes, we're handing food, but we're not seeing the trauma that is happening in the households.
Mhm.
I think that's the hardest part. And then me coming from, so for me is because I grew up in those households, I understand what's happening in them and the effects it will have on the child. So what we did through the organization, we adopted 22 families to ensure that they're financially okay. And then we just got the grant to have them buy their own food at Latino markets in the area. And we applied for another grant for intergenerational trauma counseling. And so I think for us, it was like pivoting to ensure at least these families that have worked so hard to ensure that their children had education equity, that they don't lose that, and that they're paying attention of what's happening with their child's learning, who is their child as a learner. But a lot of it, because all of this moves so fast. And again, we have to stop and listen to see what's happening in those families. You know, we can't just say, here's what these families need. No, we need to listen. And it took us a while to understand what they needed. And so finally, it was just like, they need culturally competent food. They need counseling. Their children need tutoring because they can't support them. You know, and just social and emotional, how do we get them to a sense of normal in this pandemic?
I just love the fact that you have the lens that you do. I think it's so critically important, because what you find in these generationally, institutionally racist systems that we have created, this indictment of people who need help, especially in these moments, like when we talk about what's happening in families, like it's some of the ridiculous conversations we're having in healthcare and economic and education spaces right now, where folks just don't understand what it's like to go through this kind of unprecedented trauma. I mean, if you're lucky enough to have held on to your job, I mean, we're talking about next month, you know, upwards of 25 million people being out of work. And that's not just people who have made it through the system. We're not talking about the underground economies. Like I'm thinking right now of my mother-in-law, who employs 25 women in her cleaning service. And all of that is gone now. Like those numbers are not on the rolls. Like that's not happening. Like there's unprecedented crisis happening right now. And that translates inside our homes, where we are now dealing with pressure cooker situations. If you're lucky enough to have held onto your job, you're putting yourself at risk for the virus. You're not getting great information because the systems are not communicating directly with you. I mean, I don't know about you, but we are having to do rapid response translation in a plethora of different languages to try to get out and disseminate health information, basic health information, you know, from a lot of our municipalities that just don't see our communities. But living in through this, you know, if you're lucky enough to do that, your kids are at home. Sometimes they're too young to be at home, or they're being watched by an older sibling. There's a lot of pressure coming from our educational system that if you don't do this, your child is going to be left behind, and it's your fault. And so you think about the housing instability, the economic instability, the pressure being put on you from education systems that frankly we know didn't like us very much before this, and you know, now, you know, challenging us. There's, you know, literacy issues are real, digital literacy issues are real. The most important thing is really just, you know, making sure that context is understood by some of these powerful folks that you and I are lucky enough to be in conversation with, so that we can approach these conversations with humanity and with context. Frankly, you know, I've had conversation with state chiefs across the country talking about the understanding that it's not enough just to dump a Chromebook on somebody's doorstep. It's not enough just to dump a bag full of instant oatmeal and canned peas on somebody's doorstep and say, well, we did our part. We've really got to understand what families are going through, and not turn up the heat on families by saying you're not doing enough, and understanding the context that this is a pandemic. This is not just, oh, we're all going to work from home. This is a crisis and a trauma that we're all going through. And we're just so proud of you for using your voice, Judith. You've been on the national news, you've been on your local news, you've been in the hood, you know, doing this work. So tell us what's next for you and how you continue.
So right now we're working with consultants for our work at here in Arkansas to build our programming and our operational model for the organization. It's ready to bloom. It's ready to, just like in your face. I'm so excited. I don't like to put plans ahead because I usually find when I say I'm going to do this, this, and this, I'm in my head and I'm limiting myself to the potential. So I'm not sure what's ahead. It's
so funny, and why, we are sisters in service here. It's the approach of having women, having mamas, having Latinas do this work. I always see, like, especially in the parent advocacy space, you get a lot of fancy white men who are always like, guess what I'm gonna do? I got great plans. They talk a good game, but then when it actually comes down to doing the work, it all kind of falls apart. So I just so identify, like, you give me life when you say that, saying like I'm gonna see, I'm planning, we've got some things happening. Like I so identify with that.
Yeah. So, but that's, don't cut your wings, right?
Yeah.
Don't cut your wings. So, but I'm excited to be part of the National Parent Union. It's a powerhouse. I am growing so much. And, just having the tools and the resources, that we all have together to amplify the parent voice. And that's really all that matters. Parents are being heard.
Judith, before we go, my last question is just about the parent survey that we just put together, our poll of parents nationally. Which tells us that 2/3 of parents say they're not ready to have their kids go back to school quite yet, because this is a really challenging time. These are systems that have let us down in the past, and we're frankly not ready to trust that they've got it together, that they can keep our kids protected. And also, 2/3 of parents saying, like, the time has come to innovate. We don't want to put our kids back in that box that wasn't working. It's time to rethink education. So I know, in some of the families and communities we work with, that's a challenge, because we're under pressure to go back to work because we're doing those essential jobs. Businesses are trying to open up. People want to take care of their families. And feel the need to send kids back to school just so they can work and so they can survive. But at the same time, so many concerns about whether or not we can keep our kids safe. Talk to us about your perspective and what you're hearing from parents about that.
So after we got the survey, I went to the streets because I'm like, I need to hear from, like, my community what they think. And, every time I would go shopping somewhere, I would ask the mama at the register or at the restaurant. It's like, how do you feel about your child going back to school? And, the response was like, I don't feel comfortable. I don't feel comfortable. And, I would dig a little deeper, and it's like, how are they going to protect our children? These are normally parents that do not understand an education structure, but they understand the health of their child, and they are concerned. And they are concerned that they don't have a voice in making a decision. And they're going to keep their kids home if they have to. My kid's doing fine at home, and I'm going to stand on that.
Yeah, that's another thing that did come out in the survey. Parents feeling pretty confident that, they're helping their kids. They actually feel like what's happening right now, they're getting through it. They're getting through the majority of the work. They're helping their kids. They're feeling kind of confident in the fact that they can support their kids until we're through this, and that their top priority really is making sure our kids stay safe. So Judith, thank you so much.
Thank you.
Much. You are amazing, a powerhouse from Arkansas. I had no idea that God would put in my life a beautiful friend from Arkansas, but here you are, and you are such a sunshine to me. So blessed to have you in my life. You inspire me so much as a mama, and just love you so much. So enjoy your day. And have a wonderful week. I'm sure I'll talk to you a million times, because that's the work of our union. We coordinate all the time. All right, Judith Yanez joining us from her perch in northwestern Arkansas. Extraordinary lady, the founder and executive director of Rooted NWA. Imagine that extraordinary work with immigrant families in northwestern Arkansas, now blossoming across the state of Arkansas. Now, a very important conversation. I'm very excited to welcome our next guest, Maria Gonzalez, who is joining us from where we are here in Boston, Massachusetts, but she is with an extraordinary group called Healthcare for All. doing extraordinary work with immigrant and really focusing on immigrant health. So many of our members of Massachusetts Parents United very connected with Healthcare for All and their advocacy because frankly, we need it. It's critically important. And when we talk about all the ways that our families unfortunately have been underserved, even in the best of times, Healthcare for All has been there for us doing advocacy work and fighting for our community. So Maria, so blessed to have you with us. Thank you for joining us this morning.
Thank you so much for having me. Good morning, everybody. I'm just really paying close attention to all the conversations that are happening because it's inspiring. At the same time, very concerning to hear that the things that we're seeing here in Boston and Massachusetts in general are happening in other communities. And I know we're going to be talking about health, but I think that in part, we're more fortunate here to have programs that can help a variety of communities, and we're trying to push them through. I'm wondering what's happening in other states when they don't have those resources available to specifically undocumented communities and so forth.
Well, you know, it's been extraordinary efforts, long-term efforts like the work of Healthcare for All that has made Massachusetts a leader. And that's why it's critically important that we lift up your work in this moment and bring it to our national audience and to our affiliate organizations across all 50 states here, because the work in Massachusetts, it's not perfect. There's a lot more that needs to be done. Certainly we know that, and we'll get into that, but we've got some good ideas, and we've fortunately always been leaders in the country when it comes to really, advocating and doing the right thing. And now more than ever in this moment, especially when we're dealing with a pandemic, it's critically important. So Maria, I want to jump right into this, and we should kind of talk about this holistically, because it's seeing this work, as somebody who works with parents and families every single day, healthcare is so interconnected to everything. If you do not have your health, if you are constantly in worry and fear, and frankly, if you have if you don't have health insurance and you're rushing to ERs and you don't know what to do, this can be such a moment of panic. Can you talk to us a little bit about where it stands from your perch in Massachusetts? How are we doing in terms of just communicating the urgency of this moment to immigrant communities across the Commonwealth, and how has that been good and bad?
We need to do so much more. Like a month ago, we started hearing from doctors from different hospitals in the area, from Massachusetts General Hospital, Boston Medical Center. They were telling us that they were seeing a lot of Spanish speakers in their units with COVID-19. And they were telling us that they were not getting the basic information that you were talking about. You were mentioning this before. So at Healthcare for All, we decided that we needed to do something about it. It was the time to get out and talk to people. So we've been doing this kind of shows and trying to connect with community leaders from throughout the area to really get that information across. So there was a lack of information, or the information wasn't getting through our communities. Because yes, we have daily press conferences from our governor, and we have all this information being shared constantly, but it wasn't getting to our communities. And some leaders are doing an amazing job trying to get this information across. But we felt that specifically Spanish speakers and Portuguese speakers were really lacking the information that they needed, and they were doing the essential work, which means they're out and about, and their chances of getting infected and getting very, very sick were very high. And I'm gonna highlight an example of something that was on the Washington Post last week. There was a story from a man from East Boston who died at home because he was in fear of going to the hospital for two main reasons. One, because of immigration issues. He was documented, he had temporary protection status, but his wife wasn't, and his child wasn't either. So I think that he was in fear of going to the hospital thinking, what if they ask me about the immigration status of my family? And then the second fear that he had was medical debt. Like, how am I gonna go to the hospital and then they're gonna send me a bill, I'm not gonna be able to pay for it. So he was so stressed out, he decided to postpone care. By the time he was ready to go, he told his wife, this is the story on the Washington Post, I'll go tomorrow, and he did not make it through the night. This story is keeping me up at night. And I was thinking, I've been talking for weeks now, this is a matter of life and death. This information is critical. Please, let's make sure that we get this information to the community. And that just kind of made me realize that I was totally right, that not telling people that going to the hospital is safe, that having health insurance can save lives because it's going to make much easier to access not just the test, but also treatment. And the fact that getting services for COVID-19, it's free of charge for the consumer for the most part, and we can help them, but it's also not something that's going to be taken into account by immigration, whether because you're applying to adjust your immigration status or because you think that they're going to show up at the hospital, because hospitals and community health centers are what's called sensitive locations. So immigration officials are not going to show up there. And this information for me was so basic, everybody should know this, right? Well, they don't. And that's why we're seeing people dying at their home. That's just as bad as it gets.
Maria, I'm getting emotional listening to
Yeah.
you because even just thinking pre-COVID, it is so hard to trust even these sensitive places. I mean, I will never forget about a year and a half ago being in a library in East Boston with 60 undocumented families talking about nutrition and the fact that they live in a food desert. And we were having just a conversation. How do we feed our babies? How do we do a better job finding produce? A very basic conversation that families have. We want our kids to be healthy. And the word got out that Boston Public Schools was coordinating and sharing information with ICE. They said they didn't know it was getting entered into a database. And here we are in a sanctuary city, or a sanctuary city, as I call it, because what sanctuary actually means, I think it sounds great at a microphone, but when it's your life and it's your children and it's everything, like, frankly, when our families come from, from situations where they are in fear of the government, Marty Walsh does not look that different from Donald Trump. And how do you tell the difference? It's people like us who are the bridge and who tell people who are safe and who are not safe. It was so violating in that moment to be in that library where, we had convened these beautiful families who trust us, and then to find out that sanctuary doesn't mean a lot. So I so deeply understand that fear, and that heartbreak of not knowing who to trust. And frankly, many of the conversations we've had here on this broadcast have, whether it's around immigration issues or just overall racism, people not willing to engage with the healthcare system because they know what they're going to get. And again, as I said earlier, racism and all of this xenophobia did not take a break because we have a pandemic. People would much rather die in their own homes. And we've had people say this on this air. They'd much rather die at home with their family than alone with people who do not care for them and don't take their symptoms seriously or can't communicate with them, in a hospital. And so how do we break through that? And how do we have those conversations? And the other piece that just really struck me about what you were saying is that language piece. And pre-COVID times, again, Massachusetts Parents United and the National Parents Union, we make no bones about it. We hold the Department of Elementary and Secondary Education to account all the time, saying, where is the translation? Where is the interpretation? How can you say you're in conversation with families and you're barely translating into Spanish, let alone Vietnamese, and Khmer, and Cantonese, and hundreds of other languages, and you're telling us it's too expensive to do this. This is the struggle every day in pre-COVID times, and now it is more critical. So I know part of your job is beating people over the head, saying this is a moment of crisis. We've got to do this. Tell us, are we getting somewhere in this fight, and how do we build trust with communities, and at the same time, speak truth to power to make sure that we get that information to them?
You're totally right. There's so much more work to be done. This is structural racism that it's been there, and it's just exacerbated by the crisis. We are seeing that many communities of colors have been hit the hardest. And we have an example here in Massachusetts where Chelsea has become a national example of how communities of color are really struggling. They have a very high infection rate, and they also have many struggles to access food, nutrition. Many people have lost their jobs. So this is a real thing that tells you there was so much more work to be done. And I know that we have very powerful leaders in that community specifically that are feeding the people and advocating. And I think that's the key piece here.
We love her. She's such a beautiful,
Yes.
extraordinary, and Judith and all of the people doing.
And Judith used to work for Healthcare for All. So yeah. See, so the thing is, there's so much more to be done, but I do think that we need to look at the big picture, as you said before. And it's like, what are the next steps to get the information to the right people? If they don't trust the authorities, they're not going to watch Governor Baker talk about, what's going to happen. We're going to close the schools. They have to hear this from somebody else. So we need to really find the trusted sources. And of course, we can do it in Spanish. I have somebody who's doing this work in Portuguese, but we need to really expand this work to other communities. We don't have the bandwidth, but I'm going to send them, like a shout out to all the organizations that are doing this work with other communities, to tell them to keep going at it, to try to get the information. And I think the next stage now is to really make sure that people are getting the information when they're in the front line. So I think we're trying to figure out if we should partner with organizations who are giving food, so that they can also give information about how important it is to have health insurance right now, because there's so many barriers to access testing and treatment, that having that coverage that's available to anybody, who even people who are undocumented, is just critical at this stage. I'm talking about prevention at 3 levels. One is obviously the prevention piece, and cover your mouth and wash your hands and all that. But the third one really is have your health coverage ready and up to date before you experience any symptoms. That's kind of like the big message that we're sending right now.
Well, we love having this information from you. So we're going to be, obviously holding the work that you're doing here in Massachusetts up as an example of how it is possible. But through our work at Massachusetts Parents United, in 17 different communities across the Commonwealth, we now have broadcasts in 6 different languages. We're going to be disseminating all of this information so that folks understand that healthcare coverage is available. It is important. These resources are available to you. They're necessary. You don't have to. One of the things that we're seeing is like, well, I'm just going to get it anyway. So, I might as well just go through it. You don't have to go through it. It is critically important, not just, for you to maintain healthy, but everyone around you to maintain their health, so you're not bringing it back to our elders. And we're even seeing, an uptick in positive, results from our children as well. In this moment, it's critically important, that dissemination of information. And you're talking about sources. I think community organizations, like obviously, we try to do this with NPU, but all of these community organizations, this beautiful network of ambassadors that speak the language of our communities, it's so critically important. The other piece of it is ethnic media, and understanding how important these, your low power FM radio station in the Haitian community, getting that information and engaging those folks right now is critically important. I think what we're finding is trying to get our elected officials and our policymakers to humble themselves, to maybe consider the fact they don't know everything, and to be in conversation. How successful have you been in terms of being in conversation with them and getting to them to see how critically important that these community level, like really authentic grassroots level organizations really are for getting information?
So we've been talking to the authorities in the last, obviously, we've always been connected, but in the last month and a half, we're really touching bases with them all the time. And we let them know that it was critical to use the right person to give the message out. You cannot just have the Secretary of Health and Human Services give information. You cannot just have the epidemiologists give the information out. That's not going to get to the communities that are being hit the hardest. So we kind of took it upon ourselves to do this work, but we're letting them know this work has to be expanded. It cannot just be on a couple of people giving the information out. And we know that many community leaders are doing their work, but many community organizations are focusing on providing the nutrition that our communities. So they're focusing on that, and the healthcare piece, we really need to step it up and go to where the people are, to connect people to health coverage and with the right information about how to prevent infection. And what you said is very important. My theme for the last, I think, 6 weeks has been the health and the life of our community members is in our hands. If you get infected, you're going to infect somebody else, and that person is going to infect somebody else, and then somebody may die by doing this. Very critical to ensure that you wash your hands constantly, but just you don't want to have that in your hands, right? Don't try to say, as you said, I'll just get it. It's fine. I'll get through it. You don't even know if you're going to get over it because anybody can get very, very sick. Yes, there is a higher risk of getting extremely sick when you're over 80 or when you have a pre-existing condition, but that doesn't mean that you're not going to get very sick. You don't know. The most important thing here is prevention. And as part of that prevention package, having the health coverage set up and ready to go, it's just more critical than ever. As I said, it's like we're seeing people who have been getting testing and getting bills for testing. You can fight those bills, but that information is not out. So these are the kind of conversations that I've been having one-on-one, but there's so much more work to be done. And you're right. I mean, there has to be a change in how we approach the information dissemination for our communities, utilizing community serving news outlets. I used to work for Univision many, many years. So this is something that I work for El Mundo newspaper, and I know Alberto from El Mundo newspaper here in Boston has been doing a great job in disseminating this information. El Planeta, Telemundo, like they are all in about, and that is what you need to use. But even small producers, radio producers are key to get the information out. And as I said, they're not going to be watching Channel 5, Channel 7 with the governor giving a press conference. So you need to like take it to the next level. And I think we're having these very serious conversations. I'm like, what was the disconnect that our communities were not getting the right information at the right time? And that is costing lives, really.
And you know, it's critically important. I hate that we had to learn this lesson this way. But I am hoping that this is a long-term lesson that we're going to take away. I'm always looking for opportunities in this challenge. And I am hoping, you know, as we rethink, you know, as we reemerge, what society is going to look like, that we learn, we take this information that we have here about how important, you know, working together in collaboration, co-creating these processes so that through everyone's context, who needs to be at the table, who's the right ambassador of information. Like we're seeing this have life and death consequences. And I hope it's something that we take from this, that we permanently change. Maria, I've learned so much from you in this conversation, and I'm thinking through, you know, our seat as part of the task force that's reimagining in Massachusetts what reopening, you know, our schools is going to look like. And, for how I can advocate to make sure that, you know, yes, you know, when food comes to the door and it's dropped off by the buses, or you know, you're going to pick up food from a community center, having that information. But as we re-enter schools, we also need to be rethinking how does that information, how do we make sure that every public school student, as we re-engage them, has access to the healthcare information? It makes sense. It makes sense that we would use that mechanism to get information about healthcare to the families immediately. So I'm going to take that away from this. Maria, how can we get a hold of you and find out more information about your organization and make sure that people are using your resources as well?
We have a website. Our services are more oriented towards Massachusetts, but we've been actually helping other organizations throughout the country, and we've been in touch with, like we get calls from community members from other states as well to see how to navigate things. What we did, and this is our recommendation, on our website, hcfama.org, which stands for Healthcare for All Massachusetts, we created a new section on COVID-19 right on top, and you can see it right away. And we've been creating resources. Every week we come up with something else, and we translate it at least in Spanish and Portuguese, and we're really hoping to get more bandwidth to do other kind of work in other languages. But we created resources about access to coverage during COVID-19, the impact of public charge during the COVID-19 pandemic. Public charge is this test that people will have to overcome in order to become green card holders. That's a big thing for our communities. It's translated in 3 languages in a very simple way. We work very closely with MIRA Coalition, which is our Immigrant and Refugee Advocacy Coalition. We work with Maslow Reform Institute, with Health Law Advocates. So we have that resource there. We have another resource about accessing prescription drugs during the COVID-19 crisis. Many members of our communities have asthma, have diabetes, have other conditions, and they still need to keep track of those conditions. They need access to the prescription drugs. So there's a whole resource about how to access those prescription drugs. Accessing oral health during the COVID-19 pandemic. I'm like, life doesn't stop with the pandemic. There are other things that have to be handled. So we translated those resources, and we've been disseminating that stuff. So I would recommend people to actually go check our website. As I said, it's very Massachusetts specific, but there are many things that are there that are very generic for people in other states. It's hcfama.org. And we have many other resources, LGBT communities, like specific resources, mental health, access to mental health. And this reminds me of what you said about accessing services in your language. There's an expansion of telehealth, but are we providing the interpretation services for our communities during through these telehealth conversations with our doctors? Is mental health available really for our communities when they need it the most? Do we know how to navigate the stigma and how to access those services during these traumatic circumstances? There is so much more work that we need to do really to ensure that our communities have access to the resources they need, and they know how to access them and they know how to utilize them. So I would recommend people to really go to our website. We do have a helpline that serves Massachusetts residents and connects them to health insurance. So we ask a lot of questions and we'll help people navigate the health insurance program, the health insurance services. But I just feel like this kind of program should be implemented in every single state, because every state has differences in terms of which programs are available. The laws are different. Like Massachusetts has been very proactive in ensuring that people don't have to, out-of-pocket expenses when they access services related to COVID-19. So you need to contact your healthcare advocacy organization in your state. And you were introducing Healthcare for All. We've been around for 35 years. We were the first healthcare consumer advocacy organization in the country. And from that, you have seen created other organizations throughout. So many states have some kind of Healthcare for All, and I would recommend you to reach out to them.
And I think the examples that you provide are so powerful, especially for us as parent and parent advocacy groups across the country, because if we've got a good example, we can take this back to the different states and say, if they can do it in Massachusetts, like this is what's going to be needed. So I think just the lens is critically important on top of the Massachusetts. So thank you so much for
My pleasure.
your work and everything you're doing to support our families and our communities in this moment. So stay strong, take care of yourself.
Thank you. Trying.
Gotta keep going.
Thank you so much for having me. And as a parent, I think that this is just, it touches all of us because there's so much going on. And I feel fortunate every day that my kid doesn't have to struggle with many of the struggles that many of our families have to. And I feel like we all need to like help each other as much as possible.
And find our humanity. That's
yes,
so
absolutely.
Blessing to have mamas in this work, leading this work and having our voices heard. Maria, thank you so much for being
Thank you.
What a nice, wonderful way to start
great.
off our week 9
That's great.
of the quarantine. I just think, being centered in, how do we bring humanity and resources to our families, get our minds right as we enter in this 9th week. I think it's critically important. So just so grateful that we had these folks join us this morning. Judith from Arkansas, Maria from here in Massachusetts, just critically important to talk about some of the most important and critical things we need to be in conversation with our communities about, which
That's
is
right.
making sure our health is taken care of, making sure that the information, like so much information is floating out there, but whether or not it's actually permeating the communities it needs to reach, it's really,
very important. It's really
hard.
important.
It's hard.
Well, I rejuvenated with another cup of coffee.
Well, you look perky.
And I'd like to bring up something. During your time with Judith, you mentioned something that I found a little bit offensive about canned vegetables and instant oatmeal. And I was hoping that maybe you could tell the audience what you had for breakfast yesterday and some of the ingredients.
I did. I had a lovely breakfast because you do know what to do with canned vegetables. I had an amazing spinach omelet.
Which is funny because you had told me we were out of spinach, but
because I looked in the refrigerator, there was no fresh spinach, but we did have canned spinach, and I gotta confess, it was really, really good.
Yeah,
it was super good. Yeah, I loved it.
Well, I'm glad you enjoyed
I'm
it.
obsessed with spinach. I'm there. I'm just putting.
Well,
it out
luckily
there.
we have several cans of spinach.
Yes.
And I'm glad that you enjoyed those canned vegetables.
I think there's some left over too. I'm hoping.
Oh, we
can
have
get in on that.
we have plenty left over. We have plenty of canned vegetables.
That's right. Tim shows his love for all of us by stockpiling, and
That's
boy,
right.
do you love us a lot.
There's a lot of love going on. And well, everyone, thank you so much for joining us today. Thank you for getting our week off to a wonderful start. I Thank you very much. That's all I
And
got to
we'll
say.
see you tomorrow.
See you tomorrow
Thanks
for some
being with
more.
us. Bye now.
Bye, everyone.